Will cancer be treatable by 2050? It doesn't seem so. Cancer-related tsunami may hit the world in next few years. Annual cancer cases are projected to nearly double from 20.6 million to nearly 35 million by 2050, driven by growing and aging global population. Approximately 1 in 5 people will develop cancer in their lifetime, and over 92% of the global population will be affected either personally or through loved ones. According to World Health Organization, millions of people are facing physical, emotional, and financial trauma of cancer. This dreaded disease is claiming more than 26,000 lives every day. World Health Organization reports that with estimated 20.6 million new cases, most of them, nearly 10 millions, will suffer death. Right now, cancer is the second leading cause of death globally after cardiovascular disease. And if no urgent steps are taken to control this disease, cancer cases are projected to rise to nearly 35 million by 2050. World Health Organization says that most people will be affected by cancer at some point in their lives or that of a close family member. One will have to understand that cancer is the most financially and socially devastating challenges one can face. World Health Organization warns that before this massive surge takes place, different countries will have to urgently improve early detection, treatment, and prevention. Can treatment of cancer be found and cured by 2050? It doesn't seem so, as cancer is not a single disease. It is hundreds of different complex diseases. However, medical experts are of the opinion that many types of cancer may be manageable and preventable illness by that time. They say that better screening tools will come which will catch tumors much earlier when they are easier to treat, and that more aggressive cancers will become manageable conditions and that people can live with it for decades. Approximately 90% to 95% of all cancer cases are caused by lifestyle factors and environmental exposures rather than inherited genes. Only about 5% to 10% of cancers come from faulty genes passed through parents. Smoking and tobacco are the leading cause of cancer and cancer deaths. Eating unhealthy food and carrying extra body weight raises the risk of cancer. Alcohol should be avoided as drinking alcohol breaks down into toxic chemicals that damage cells. Ultraviolet rays from sun causes about 90% of skin cancers. Certain viruses and bacteria like HPV or hepatitis can lead cell damage over time. Even breathing dirty polluted air and harmful chemicals can also cause cancer. Risk of cancer can be thoroughly lowered by avoiding tobacco, eating a healthy diet, and staying active. Daily healthy habits and lifestyle can significantly reduce your chances of developing the disease, like filling your plate with fresh fruits, vegetables, whole grains, and beans. Avoid red meat and processed meats, and should maintain your body weight. Should avoid all tobacco products and should keep yourself away from second-hand smoke. Should keep yourself physically active through exercises. The 7 warning signs of cancer are change in bowel or bladder habits, a sore that does not heal, unusual bleeding or discharge, thickening or a lump in the breast or elsewhere, indigestion or difficulty in swallowing, obvious change in a wart or mole, nagging cough or hoarseness. Should see the doctor if these signs last for more than 2 to 3 weeks.